With the Clubhouse model, what is so awesome is it's the fact that the members of the program work side by side with the staff. So when you walk into a Clubhouse, you really shouldn't be able to tell the difference between a staff person and from a member who might be receiving services. It fosters self-esteem, it fosters independence. The idea of the Clubhouse actually came about from another organization. They saw grant opportunity from the state of Ohio. I wrote the grant and we got it and been working really hard ever since, creating a wonderful clubhouse for, probably about 45 people a day. Clubhouse model is a great way to not only make a difference in somebody's life, but also from a funder's perspective, to save your county dollars.
I reflect back on working in an inpatient psychiatric hospital, and we would decide what the plan was for the patient. And the only person not present at that team meeting was the patient, was the person. And so I think when I learned about the Clubhouse model, I was like, this is where it's at. The person is the expert. It's this person's life, it's this person's goals. In our Clubhouse, we often use the phrase, no conversation about me without me. This is what I think recovery is and how we should be supporting adults living with mental illness.
My journey with my mental health started a long time ago when I was in my teens. I struggled with pretty severe depression, anxiety, and PTSD. Prior to coming to the Clubhouse, I was in and out of psychiatric units a lot. I never really got the help I needed to recover. Going to a psychiatry appointment or having a case manager does not help with the recovery aspect. The Clubhouse is what does the recovery. That's why it's revolutionary. Because I got to build relationships, because I got to participate in the work order day. As a vending machine specialist, I'll be stocking and supplying and maintaining a snack vending machine on the 4th floor of the building where we operate. I participate in advisory board meetings, I help plan events. It makes me feel really proud, and it makes me feel really accomplished, and like someday I can even be part of the workforce again. Before, when I struggled with profound depression, I didn't even want to get out of bed, and now I cannot even wait to start my day.
It has been amazing to me to see the clients and how, when I'm in the Clubhouse, nobody has any more power and control over me, and I have a voice in all of the decisions that are being made. Like, that's very powerful. Some of our most severe clients are doing the best I've ever seen them. I think grants are really needed to get these programs sort of up and running and off the ground. The Recovery Center has been able to really leverage resources and people to make it work. We should have one in every county and every state across the country, in my belief. It's just so impactful.
When a Clubhouse community is strong and when it's done right and people really care about the model and the philosophy, it can change lives. I started actually as a member of Fountain House in New York City some 20 years ago. The model really resonated with me, finding meaning and purpose to facilitate recovery and push back against elements of stigma that exist in society. I was a person in a place where, isolation and loneliness were, big factors. I started getting really involved in it and also help pay it forward, like what I have experienced. It's a joy to be able to make a career out of something that I'm so passionate about.
In 2022 is when the state of Ohio provided startup funding, and in just 3 years we've worked to grow the Clubhouse. We're now at the point where there's 12 groups that are either accredited clubhouses or working towards accreditation and developing. The coalition has existed for a number of years. They've had an incredible journey and really looking at developing relationships with those key stakeholders to ensure that that growth continues to happen.